Hello, my name is Julia Caldwell. I work for the Calderdale Safeguarding Children Partnership and the Safeguarding Adult Board in Calderdale. It's the 29th of March and this is a really short video informing you about the heightened risk of safeguarding to children and adults due to the coronavirus. There are many people operating outside the usual role during this time. They're stepping up and they're working with vulnerable adults and children and the most vulnerable in our society. The information I'm going to provide here will hopefully assist you in identifying and acting on safeguarding issues. Full e-learning is still free and available on our website www.calderdale-safeguarding.co.uk. Safeguarding is everyone's responsibility, whether you're working for a statutory service or volunteering or a member of the public. Everyone has a role to play in spotting abuse or neglect, and that's for both children or adults at risk. Abuse can be physical, emotional, sexual, financial, and neglect can mean self-neglect for adults. During the coronavirus, isolation and social distancing increase risk factors for people, and this can appear in increased levels of domestic abuse, self-neglect, in carer stress and scamming. The following are examples of how social isolation and distancing can increase risk. Here are just some of the scams that we've become aware of, but please note that criminals come in all shapes and sizes and can contact you by the door, by the phone, post or online. Be aware of people offering miracle cures or vaccines for coronavirus. There's no specific treatment for COVID-19 at the moment. People have been impersonating healthcare workers, claiming to be offering home testing kits. This is a scam. These kits are not currently available to buy. Emails saying you can get a refund on taxes, utilities or similar using bogus emails, and they're after your personal bank details. There are lots of fake products available to buy online. They say you can protect you or cure coronavirus. These will not help and are designed to take your money. There are new mobile phone applications that claim to give you updates on the virus, but instead they lock your phone and demand a ransom. People have been offering to do shopping or collecting medication and asking for money up front and then disappearing. Here are some tips to avoid being scammed. Be cautious, listen to your instincts. Don't be afraid to hang up, bin it, delete it or shut the door. Take your time, don't be rushed. If someone claims to represent a charity, ask them for ID. Be suspicious of requests for money up front. If someone attempts you into accepting a service, they are unlikely to be genuine. Check with family and friends before accepting offers of help if you are unsure. If you're online, be aware of fake news and trust resources such as .gov.uk websites or nhs.uk websites. Make sure that when you type addresses in and don't click on links or emails that have been sent to you. Only purchase goods from legitimate retailers and take a moment to think about parting with money or personal information. Know who you're dealing with. If you need help, talk to someone you know or get in touch with your local council. Protect your financial information, especially from people you don't know. Never give your bank card or PIN number to a stranger. If you are concerned about abuse or neglect of children or adults, there are safeguarding procedures to follow, and both can be found at the Calderdale Safeguarding website, www.calderdale-safeguarding.co.uk. There are a number of ways that you can support people and get help. Some of those plans and support might include some of the following. Explore concerns and the strengths in order to identify solutions and resilience within the family. Look at resilience within that family and undertake assessments of need for the adult or for the child. Identify family, friends, neighbours to support the person or the family and identify ways in which this can be done via phone or internet if possible. Discuss contingency arrangements for the child or adult's care should the parents or the carers become ill or need to self-isolate or become unable to support them. Ensure you factor in any COVID-19 pressures into any risk assessments that you do. The number of tools and guidance which can help you assess the risk, all of which can be found on that same website. That's for adults and children. If you do become aware of abuse or neglect, you must follow the safeguarding procedures that your organisation, where you're volunteering or where you're working, has. Seek advice from staff or volunteers who have been trained in safeguarding, or go to the website for further information. If you think a crime has been committed, phone the police on 101 and in an emergency ring 999. To report domestic abuse, refer to the Domestic Abuse Hub on 01422 337 176. If you're worried about a child, you need to ring the multi-agency screening team on 01422 393 336. If you're concerned about an adult, you must always seek their consent before acting, and any action should be done with the adult at risk. Mental capacity, coercion and control must be considered when you're thinking about a person's ability to make decisions and to be able to keep themselves safe. Abuse or neglect is reportable to Gateway to Care on 01422 393 000. Finally, can I take this opportunity to thank those working or volunteering on the front line, the incredible effort and contribution that you're making. Stay safe.